today again with us to discuss the black fungus. Some of you have watched our last video, which was around COVID-19 and related queries. Today, we are going to discuss about the black fungus. So let's welcome Dr. Dasgupta. Hello, Dr. Dasgupta.
Thank you. Thank you for having me. Thank you for those who have watched our previous video and given us your generous support. Thank you so much to all of you. Thank you.
Okay. So Dr. Dasgupta, there is this new thing that we are hearing about, which is the black fungus. So first and foremost, what is the black fungus?
So the black fungus, or as we call it, mucormycosis in the scientific term, is not a new disease at all. It has been there from the past. It's a fungal infection. Fungus, which normally presents in the environment, doesn't cause harm in general. Sometimes it can cause disease as well. So this is the old thing, but because of COVID, it has become much more in number than before, which is causing us the concern.
Okay, so you mean to say that people suffering from COVID are more susceptible to the disease? I mean, let me divide that question into three parts for you. If I have not suffered from COVID, am I susceptible to the black fungus? In the second question, if I am suffering from COVID, how vulnerable am I to the black fungus? If I have recovered from COVID, can I still get black fungus? So if you could answer the three.
Very good questions. So basically, black fungus affects the people who have a very compromised immunity. So number one, if you have a compromised immunity in general, so HIV, severe other illness, renal transplant, kidney transplant, liver transplant, and you're taking immunosuppressant drugs, you are on steroids for any duration of time, you are on other immunomodulator drugs for other conditions. So anyway, if your immunity is compromised, then you are more susceptible to black fungus with or without COVID. Now, if you are suffering through COVID and you have been given a lot of steroids for a long period of time, then you are susceptible as well, but short. Usually for most people, the steroid course in COVID is very short, 5 days, 3 to 5 days, maximum 7 days. That doesn't make you more susceptible to the black fungus. However, if you are COVID recovered, but then you had a prolonged history of steroids during COVID, maybe you were in the hospital or even at home, you took a long duration of steroids, 3 weeks, 4 weeks, high dose of steroids, then your immunity is compromised, and then yes, there is a cause of concern about this black fungus.
Okay. And how do I know that I have the black fungus? Are there any symptoms that I should look out for?
Right. So the symptom wise, essentially you can get a headache, you can get a facial swelling, facial puffiness, you can also get double vision or hazy vision. Those are the usual symptoms. There can be other symptoms as well, but then you have to see it in the backdrop of a history of prolonged steroids or other immune compromised situation.
Is the black fungus contagious as well? Does it spread from me to someone else?
Very good question. No, the black fungus does not. The black fungus does not spread from one person to another. The black fungus we get when we inhale the fungal spores from the environment. The fungus is there in the environment. If somebody inhales the spores and that person is already immunocompromised, then there is a possibility of getting that disease. It will not come from one infected person to another. It does not spread like COVID.
What are the ultimate consequences of this disease? As in, is it very fatal? Is it something that is chronic, very severe? What are the consequences?
So the reality is that for any person who is immunocompromised, whose immunity is compromised, any normal disease becomes more severe. So this black fungus, as it affects only the people whose immunity is already weak and down, mostly it is doesn't give a very positive outlook. However, there are excellent medicines. We have IV injections to treat this fungal disease, which gives good hope. And the main thing is to prevent, but yes, the medicines are also there.
Okay. So from the solution point of view, you are saying that there are medicines, IV injections,
Absolutely,
etc.
absolutely.
that can help.
Antifungal drugs are there. Absolutely.
Okay. And I would also want to know if uh, how should I test for it? For example, for COVID, I can do an RT-PCR test. How do I test for the black fungus?
Very,
And
very
for
good
COVID, you
question.
had
Yes.
yeah, and also for COVID last time you had mentioned to maintain an oximeter at home and check for oxygen levels, which was 90 plus for old people and 94 plus for young people. I want to know if there is any such toolkit for the black fungus as well that we can keep at home.
No, no, no. If you are getting a black fungus, please don't stay at home. Go to the hospital. So it doesn't happen at home mostly. For testing for black fungus, so basically, black fungus is a clinical diagnosis. You have to speak to the doctor and explain the symptoms which are happening. If it is a severe case, what we can do is that we can take a scrap. If you are getting a swelling somewhere, some infection or puffiness is there, we can take a scrap from there or swab from there, and it is called a KOH stain. We can test to see if the fungus has grown there or not. So that is possible, but mostly it is very easy to diagnose clinically. And so basically the black fungus grows inside your body, and as it grows it clogs your blood vessels, and as your blood vessels are clogged, one portion of your body doesn't get the blood supply, and so it becomes black. That's why the name black fungus is. In general, if you get black fungus, go to the hospital, don't stay at
Okay.
home.
And from your experience, doctor, we would also want to know your opinion around this. There are certain people who very vehemently and intensely, emotionally say that they will not let the third wave of COVID come about. Some of the people in our country's leadership in the government, and there are others who say that the third wave is inevitable. How do you see the next few years? By when do you think we will be able to do away with this pandemic? What is your opinion about it?
Okay, so the truth will go by the truth, by the data and the evidence. So the data and evidence overwhelmingly point that there is definitely going to be a third wave. There is no two way about that. The third wave is coming, and it will be maybe 3 months, maybe 6 months, most probably 6 months down the line. It can be little bit earlier or later as well, but third wave is definitely coming. People who think that no, they will not allow it to come, it is good gesture. I salute their thinking, but then the data is different. We all hope that it doesn't come, but then the data also is suggesting that it will come.
Okay, there's a high probability of a third wave, and we can see
it's almost
that
it's
the
almost
pandemic will
certain
take some time to go.
it's almost certain it will take a miracle for third wave not to come. Let's put it that way.
Okay. And is there anything that you would like to share about the hospital industry? Because we are listening to a lot of negative about the hospital industry, that the nurses are not available when the patients want it. There are some people who have been grateful and who are saying that they really did get the care. Some people, I will not say they were not grateful, but they actually did not get the care. And of course, we have all kinds everywhere. So I want to know your opinion about what is it that the hospital industry is facing right now? What is it that the staff is facing right now?
It's actually a very, very broad topic. To say very on the brief, if you let's talk about the people who are working in the hospitals right now, the doctors, the nurses and other staff. These people who are working in the hospitals taking care of the COVID patients, they are no way less than the soldiers who are fighting in the border. That's the truth of it. So what do the soldiers do? They risk their lives to protect the people of the country. Same thing is here. The doctors, the nurses and the other people who are working day and night in the hospital, they're risking their lives to protect other people. And as you can see that doctors are dying. More than 1000 doctors have died since COVID has started. More than 1000. It is equivalent to more than 1000 army or soldiers dying in a battle. It is as simple as that. So people who say, that doctors are not providing adequate attention, or hospitals are not treating them well, they have to understand their expectation has to be realistic. There are one doctor and there are 100 patients. There is one nurse, there is 200 patients. So your expectation has to be realistic. And unfortunately, the amount of respect and the government support that the army and their family gets, the doctors and nurses are not getting even 10% of that. That's the unfortunate truth. And some people are saying that so many COVID patients, the hospitals must be making a lot of money. That is also very much wrong. Hospitals make profit out of procedures, surgeries, and other medical procedures. It is a loss for the hospital if somebody is in the ICU for 7 8 days, or in the just like that receiving treatment for COVID. So from the financial point of view, the hospitals are in a very very bad shape. On top of that, government is putting a cap on the amount of charges that you can take per day from per patient. So definitely financially in a very bad state, and people are dying without getting adequate compensation. So people who are raising hand at the hospitals and the medical fraternity should have their realistic expectations. That's all.
So, Dr. Dasgupta, we have heard about this new testing kit that people can use at home to test themselves. I don't know much about it. If you know about it, could you just tell us how foolproof a way it is?
Okay, so this is about the RAT, or the rapid antigen test for COVID. So earlier we used to have this rapid antigen test. It gives you a result in about 15 minutes to 30 minutes, and earlier it used to be in the labs. So now the government has said that this kit you can purchase from your local pharmacy shop, and you can do it on your own at home. So this leaves you better position. You don't have to approach a laboratory, and much cost effective as well. However, having said that, this is not the RT-PCR swab test. So this rapid antigen test is not as good as the RT-PCR as of now. Hopefully it will improve in the future, but as of now it's just the rapid test, which may give you some indication but not a very foolproof concept.